Hi, I'm Dr. Michael Taggart with Lake Washington Chiropractic. I'm a board-certified chiropractic physician with over 18 years clinical experience. I have advanced training in neurology, spinal rehabilitation, and metabolic and nutritional testing and treatment. I want to welcome you to our Thyroid Recovery Program DVD, where we explain how we treat our patients both neurologically and metabolically, and we explain how this is going to help you with your chronic thyroid condition. The information I'll be sharing with you is somewhat technical in nature, so I recommend that you maybe watch this DVD more than once to help you understand the concepts. Also, it would be a good idea to take some notes throughout the presentation. There's a website that I'm going to bring your attention to. It's called www.lifechangingcare.com, lifechangingcare.com, all one word. I'd like you to go to that website and click on the testimonial section and spend some time reading about the testimonials of patients who have been helped with the kind of therapy that I do and other doctors throughout the country who have been trained in a similar manner to myself. There's a section strictly on the thyroid. There's also testimonials from patients who have been helped with all kinds of chronic health conditions like fibromyalgia, chronic neck and back pain, peripheral neuropathy, migraine headaches. And so as you watch these videos, it's going to help you have some hope that if these people, many of which were told there was nothing more they can do and they would just have to suffer and be on medications for the rest of their life. So if these patients can get better, then that's going to give you some hope that you can get better too. Now, a lot of the information I'll be sharing with you today is based on this book called Why Do I Still Have Thyroid Symptoms When My Lab Tests Are Normal? And this is by a Dr. Datis Karazian. He is one of the foremost authorities in our country and probably even the world on thyroid disorders and effective treatment. I would highly recommend that you get this book. You can go online and get this book through Amazon or any type of similar type of online bookstore. If you become a patient in our office and we accept you into our program, you'll get a complimentary copy of this. You'll very much enjoy this book. Now, 99% of this information I want you to know you've never heard before. And we want to talk about why thyroid health is so important. Now, a big concept to understand is that every cell in your body has a receptor site for a thyroid hormone. So if there's a problem with thyroid metabolism, that could virtually affect any system of your body. Let's talk about some of the systems that can be affected when your thyroid metabolism is not functioning properly. Well, it can definitely affect your level of energy. If you have a low thyroid, you're going to be very lethargic and you're not going to have any energy. If you have a high thyroid, you're going to be kind of jittery and bouncing all over the place and feel like you're hyperactive. The thyroid also is important with bone metabolism. There's a hormone called calcitonin that your thyroid, in conjunction with your parathyroid, helps to balance calcium levels in your body. So if you have a chronic thyroid condition, you may end up with weak bones or osteoporosis. Low thyroid function can also affect your gastrointestinal function. If the thyroid's low, the colon, the bowels become sluggish. That's going to increase the time that it takes you to digest your food, which is going to expose you to more toxins than you should be exposed to. It's going to increase the possibility of food intolerances and also developing gut infections. Low thyroid also affects hydrochloric acid production. So if you're not digesting protein, that can also set you up for a lot of digestive issues. It also has a big effect on your hormones, both male and female hormones. If a woman has a very low thyroid, she will not be able to ovulate and won't be able to conceive. Thyroid imbalances, especially low thyroid, can also affect your detoxification mechanism, like your liver and your gallbladder. Those become sluggish. It decreases your ability to detox your body. And also, we often find that patients who have a low thyroid will often have high cholesterol and high triglycerides. When the thyroid is brought back into proper function, these blood lipid panels become normal. Now, another thing that can happen when you have a low thyroid is that you can't burn fat. So as a result of that, you don't lose weight, despite diet and exercise, and that can be very frustrating for people. It also can impair your ability to metabolize glucose. Glucose and oxygen are the fuel that your brain needs. So if you're not getting proper glucose metabolism occurring in your body, you're going to have very poor mental function, and you're going to have brain fog. The thyroid also has a big effect on body temperature. So if you have a thyroid problem, it could contribute to hot flashes and night sweats. Also, low thyroid can also affect anemia, because if you're not digesting proteins, you're not going to be absorbing vitamin B9, which is folic acid, vitamin B12, also called cyanocobalamin, and it's also going to affect iron absorption. So this is something that thyroid problems can also cause. Thyroid problems can also cause heart problems. There's a protein breakdown product called homocysteine that your body makes. And if that level raises, it actually inhibits your thyroid. And if your thyroid is either low or high, it can cause a low pulse, a sluggish heartbeat, or if it's a high thyroid, it can cause a rapid high heartbeat and rapid pulse. Now let's talk about the current medical model for thyroid diagnosis and treatment. Unfortunately, the current medical model is based on 1960s physiology. Now this presentation that you'll see will help you understand why this approach is totally inadequate. And that's why many patients are not improving who have thyroid problems. The information I'll be presenting is based on 2010 information. Now, if you're watching this video, it's a good chance that you've had medical care, maybe several medical people that you've seen, and the fact that you're watching this means you haven't gotten better, and so you're going to have to look at a different approach if you want to recover. And this DVD is going to teach you exactly what you need to do to get your life back. Now, there are 7 different metabolic pathways in the body, so this would be something good that you'd want to start making some notes about. We'll go over each pathway. Now, here's the thing that's really surprising to people, is that only one of these pathways is really a fault of the gland itself. The rest of the problems are something else going on in the body that's affecting the thyroid gland. So let's talk about some symptoms. Actually, let's talk about thyroid metabolism so you can understand a little bit about how the gland works. So here's what happens. There's a gland in your brain called the hypothalamus. And the hypothalamus senses the level of thyroid hormone in the bloodstream. If this gets low or high, the hypothalamus is going to respond to that. If the level of thyroid hormone is low, the hypothalamus is going to send a neurological signal and a chemical signal to the pituitary gland. The chemical signal is called thyroid releasing hormone. Now, if that pituitary is functioning properly, it will respond to that stimulus, and it will also send another neurological and a chemical stimulus to the thyroid gland. This stimulus is in the form of what we call TSH. You may have heard of this, thyroid stimulating hormone. The pituitary makes it. When the pituitary makes it, it's trying to tell the thyroid gland that it's time to make more thyroid hormone. So when this stimulus occurs, the thyroid makes a protein called thyroglobulin. It combines it with an enzyme called thyroid peroxidase, and then it also combines either 3 or 4 molecules of iodine, and it makes what we call T3 and T4. Now this is very important. Once the thyroid gland makes those 2 hormones, only T3 is the active form. T3 is what creates the activity in the cells. T4 is inactive. It doesn't have any real strong physiologic function. Now, your thyroid gland, when it makes these hormones, only 7% of it is T3. So if this is the active form and only 7% is made by the thyroid, and the body relies on the rest, other tissues, converting it to T3, and if that's not converting, then we have a real problem. 93% of T4 is going to be converted in the liver to the active form of T3. Now, of that conversion in the liver, 20% is what we call reverse T3. It's not active. It doesn't have any physiological function. Now, of the component that is not converted by the liver, that will catch a ride with something called TPG, or thyroglobulin binding hormone, and that will actually go into your muscles and your nerves, and the peripheral of the tissues of the body will convert that into T3. Now, another 20% will also be converted in the gut to the active form of T3. So if we have a liver problem or a gut problem, then we're not going to get that conversion, and you can see how this would be a huge problem. Now, here's the thing that's very important to understand. If your doctor that you've been seeing for your thyroid has not thoroughly checked your liver or thoroughly checked your gut, then you have not had a proper workup, and it may be one of the reasons that you're not improving. Now, a lot of people come to my office saying, well, I've had the blood test, the doctor says they're all normal. Happens like over and over again. So there's two reasons that's happening we want to discuss them. One of the problems is the medical doctor typically is not testing enough of the markers for thyroid. So they're not finding the problem because they're just not doing enough testing. Typically medical doctors are only doing TSH testing and T4 testing. So the TSH tells us what the pituitary is trying to do, and it tells us how much T4 is made, but T4 is inactive. So if we only check T4, we cannot possibly find out how much active thyroid hormone is in the bloodstream that needs to get into the cells. So that's totally inadequate. That is just not going to work. We need to do a more comprehensive thyroid panel. We need to check not only TSH, but we need to check total T4. Total T4 is T4 that the thyroid gland makes, and in the bound form, which is going to bind with the TPG, which is going to go to the cells, and the unbound or the free. We also need to check T4 by itself. We need to check total T3, which is bound and unbound, and free T3. Free T3 is the active form that's eventually going to get into the cells. So if we haven't checked these things, we really haven't done a proper assessment. We're also going to check something called T3 uptake, which will tell us how many of these thyroid binding globulins are in the bloodstream. That's very important. And also we're going to check thyroid antibodies. If you have an immune system problem, your body can make antibodies to your own thyroid gland, and that's happening. That's a big problem, and that's something that we address in our office. You probably have never had this test, and it's something that's been greatly lacking in your metabolic workup. So let's talk about some of the symptoms that you can have when you have a thyroid disorder. And as I read these symptoms off, I want you to mentally acknowledge that, hey, this sounds like me. So if you have a low thyroid, and low thyroids are definitely more common than high thyroids, you're going to have fatigue, you're going to have weight gain in spite of exercise. I have a patient right now who has a thyroid problem, and she's been working out like crazy and dieting like crazy. She has like a personal trainer. After like 2 months of working out, she didn't lose 1 pound. How frustrating is that? And it's really because her thyroid gland has not been assessed properly, and she hasn't had proper treatment. Also, you can have headaches. You wake up with a headache and it wears off during the day. You may have depression, constipation. You may feel very cold. You may be very hypersensitive to cold. You may have poor circulation, numbness in your hands and feet. You may have muscle cramps. You also may have a situation where you have a low immune function. You get sick a lot, and when you get sick, it takes you a really long time to get better. You may have require excessive amounts of sleep. You may have itchy, dry skin, dry, brittle hair. Your hair may be falling out. You may have swelling in your body, and you also may notice that the outer third of your eyebrow is becoming thin. Now, hyperthyroid symptoms, not as common, but definitely people have hyperthyroid problems too. Heart palpitations, inward trembling, increased pulse rate at rest, feeling nervous and emotional, insomnia, night sweats, difficulty gaining weight. Now, if you have a hyperthyroid, then you're going to have, that is caused by an autoimmune disease. There's two names that we give to autoimmune problems. One is Graves' disease, another one is Hashimoto's thyroiditis. And there's different tests to determine which one you have. Hashimoto's thyroiditis is a lot more common. In fact, the number one cause of thyroid disorders is the autoimmune cause. So it's not even a problem with the thyroid gland. The thyroid gland is just being attacked by the immune system, and it's because the immune system is imbalanced and it's destroying tissue that it shouldn't. We'll talk about some of the tests that we have to run to find out if you have this. Now, interesting about the immune system imbalance, or the pathway number one, is that it can cause low symptoms of thyroid, or it can also cause high thyroid symptoms, or you may have both. So if you have both of these symptoms, you probably have Hashimoto's thyroiditis. And again, 70% of thyroid problems are going to be caused by that. So if you had a chronic problem that's not improved, there's a good chance that you're going to show with this. And the good news is that we know exactly what to do to remedy this problem. The second pathway is a pituitary gland problem. When we showed that schematic, we talked about how the pituitary stimulates the thyroid. Well, in this case, it's the pituitary gland that's at fault. It's not the thyroid. And what happens is, the reason the pituitary gland becomes sluggish is that there's some kind of stress in the body that's inhibiting the pituitary. It can often be adrenal fatigue, it could be blood sugar problem, it could be an infection or some kind of inflammation. And there'll be special tests that we'll do to find out what's causing that pituitary gland to not function the way it's supposed to. The number 3 pathway is called thyroid underconversion. So T4, which is the inactive form, is not being converted to T3. And that's going to be due to a liver problem or the gut problem like we talked about. It could also be an adrenal gland problem. Number 4 is thyroid overconversion. Too much T3 is converted and the cells get resistant to it. Now, why would that happen? Well, if you have a blood sugar imbalance, what's going to happen is that you're going to get excessive T3, and T3 is what gets you going. So if your body has too much of it, your body's going to shut down the cellular response to that because it doesn't want you to go, go into a hyperdrive. So it's a safety mechanism that the body has to keep you from getting too much thyroid, and it's really because of a blood sugar problem. Now in women, this can create other complications because when you have a blood sugar problem, which is going to be typically high blood sugar, your body is going to produce too much testosterone. You should be producing more estrogen and progesterone. You won't do that. You'll produce testosterone. You'll start exhibiting male characteristics. Your shoulders may broaden. You may develop facial hair. In women, this is a syndrome called polycystic ovarian syndrome. And that can be totally handled by getting the blood sugar evaluated and under control, and also clearing out excess testosterone in the body. So this is something that we also do treat in our office, and it responds very well. The sad thing about PCOS is that if you have this, you're probably not going to be able to get pregnant because you're not making enough progesterone to, once you do conceive, to keep the fetus viable. And I've had a lot of women who have had this, and they often have miscarriages, which is very sad, but it doesn't have to happen. We know what to do to help that. The number 5 pathway is what we call increased thyroglobulin binding protein. So we talked about the liver makes these proteins, and that T3 and T4 hitch a ride on that thyroid binding globulin and deliver it to the cell. So because of excess estrogen, either through replacement hormones or through the use of birth control pill, the estrogen level is raised too high, and it causes your body to make too many of these binding globulins, and so too many of the proteins of thyroid bind to them, and then they basically can't come off, and they can't get into the cell. So that's going to create low thyroid symptoms because there's too many of these binding globulins. So in order to address that, we have to address why estrogen is high and clear excess estrogen out of the body. Number 6 is thyroid resistance. Now that's caused by what we call high homocysteine levels. And homocysteine is a product that your body makes when you digest protein, and it's quite toxic. If you have proper vitamin balances in your body can denature that and it doesn't become a problem. But when you're lacking certain vitamins, especially B vitamins and some minerals, this level will become high, and what it will do is it will cause your cells to be resistant to T3, and that's going to again create low thyroid symptoms. It's also going to create a more stress on your heart, so it's not only going to affect your thyroid, but it's going to affect your heart. So the solution in this case would be to balance the vitamin levels in the body, clear homocysteine. The number 7 pathway is called primary hypothyroidism, and it's really the only pathway in which the thyroid gland is the real problem. Typically due to nutrient deficiencies, the thyroid gland itself will become it won't respond to the pituitary stimulus, the TSH, and typically if nutrient balance can be restored, oftentimes the thyroid gland will just start working the way it's supposed to. There are some times where it won't, and this is the case where thyroid replacement hormone would be necessary. And also sometimes with the autoimmune, if there's been so much destruction of the thyroid gland by the autoimmune system, then sometimes people will have to be on thyroid replacement too. Now, so we've gone over all the pathways. Now, with the doctors that you've seen, how many of these pathways have been evaluated? Now, on properly medicine, everyone who goes to a medical doctor typically is treated as if there were primary hypothyroidism. You either get thyroid hormone replacement or you don't. So hopefully from what you've seen, that isn't going to work because that can typically only work in this pathway. And There's lots of other causes that can cause thyroid problems. So if these problems aren't being addressed, then the doctor they've been seeing has not been trained enough to know what to do, and that's why you're not getting better. So the next thing we're going to do is we're going to talk a little bit more about some of these tests that we're going to do to help us determine which of these pathways that you have. So our pledge to you is that if you become a patient in our office, that we will leave no stone unturned to determine the causes of your chronic health condition. And so there's certain tests that we're going to have to do in order to determine what's going on. So we talked about the thyroid panel that we have to do. We're also going to do what's called a complete metabolic panel, and we'll also do a lipid panel on you, and we'll also do a complete CBC to look at your red and white blood cells. Now, as we do this, this is going to allow us to thoroughly assess your thyroid gland. It's going to give us information about what's going on with your adrenal gland. It's going to help us assess your liver. We're going to look at your kidneys. We're going to look at your red blood cells, which we're looking for signs of anemia. With the white blood cells, that gives us some indication of what's going on with your immune system. If you have like high white blood cells or low white blood cells, that can indicate an infection, either acute or chronic. It can also give us an idea what's going on in the gut. We're going to look for HCl problems. It also may give us an indication if you have allergies or possible parasites. And we do all these tests, of course, because we want to get you better as fast as possible. We're also going to be looking at, when we do our comprehensive metabolic profiles, we're going to look at your glucose level. Your brain needs glucose and oxygen to function. And glucose or blood sugar problems are involved in at least 2 of the pathway problems. Now, one of the other tests that we want to do that's very important is we have to do some food sensitivity tests. If you have a food sensitivity, it's creating inflammation in your body. If you have food sensitivity, it can create pain and also contribute to fatigue. It can also contribute to bowel problems, constipation, indigestion, mouth ulcers, sores, bloated after eating, vomiting, and frequently loose bowel movements. Now, when we do these tests, we are looking for a sensitivity and also genetic issues. You may have a genetic issue where you can't metabolize, just based on your genes, you can't metabolize lactose. You might not be able to metabolize gluten. Now, gluten is a product that comes from wheat often, and also rye and barley. We're also going to check you for eggs and yeast, and also soy issues. Now, if you have food sensitivities, it's contributing to your health condition. It's often involved in reasons why there's autoimmune issues. Another test they want to do is what's called the adrenal stress test, or the ASI test. And what it is, it's a saliva-based test that will give us more information about what's going on with your adrenal gland. Your adrenal gland is involved with creating problems in the pathway, especially the number 2 pathway, which is the sluggish pituitary gland. Anytime you have an adrenal problem, there's also typically a blood sugar problem too. Those 2 problems typically go hand in hand. And when we do this adrenal stress test, we're kind of looking for what's happening with your DHEA level, which is a hormone that your body makes in your adrenal gland that will eventually become estrogen and testosterone. We also look at your cortisol level. Your cortisol is also a substance that your adrenal gland, and it makes it response to stress, which is a good thing short term, but if we have different stresses on the body long term, the body will typically make too much cortisol. Cortisol is a stimulant. There's a graph that we do this test that we're looking for. The graph should be high in the morning because cortisol is typically going as a stimulant, gets you up in the morning, gets you going, and then as the day goes down, it's going to come down. It should be low at night. Now, you need to be relaxed at night to go to sleep, but if your cortisol, which is stimulant, is high, you will not be able to sleep. It can create insomnia. It's going to exacerbate blood sugar issues, and this is something that we would do to test. Now, if we find an imbalance here, there are all natural protocols that we can do to balance out the cortisol levels and to improve DHEA production if that's a problem also. Now, the next thing we want to do is we have to test the immune panels. Now, this is very important, especially important with thyroid problems because, as I've said, about 70% of patients who have a chronic thyroid problem, it's actually an immune problem. Nothing wrong with the gland, it's just that your immune system's attacking your tissues. Now, if you have an autoimmune attack of your thyroid, that's either called Graves' disease or Hashimoto's. If you also can have it attack your organs in your body. It can attack your nervous system. When you have that, that's called multiple sclerosis. If it attacks your joints, that's rheumatoid arthritis. So the immune system can just only destroy the thyroid, but it can also start destroying other tissues too. So it's very, very important for your long-term health and to recover from your thyroid problem to have this immune system worked out properly and balanced out so that you can improve. So let's talk about some of the tests that we do. In the immune system, there's two sides of the immune system. There's what's called Th1 and Th2. Th1 are created by T cells, and Th2 are created by what we call B cells, which are different immune cells that your body makes. A lot of them are made in the bone marrow and also in the thymus gland. Th1 are the things that kill stuff. Like if you get an infection, the Th1 is going to go to town and it's going to try to kill the bad things. Now sometimes Th1 cells are unable to kill something, or typically they can't find it sometimes, especially with viruses. Viruses are hard to find. So what the Th2 system does is it makes an antibody, or it puts like a marker on that bad cell, and so that Th1 can find it so that it can destroy it. Now, in a healthy immune system, there's going to be a balance between Th1, killing things, and Th2. There should be a balance. If one of these systems gets out of balance, becomes dominant, we have real problems. If Th1 becomes dominant, what happens is that these T cells are going to go after other tissue, namely your tissue and your thyroid gland. So if that's happening, we have to find out. The indices that we use are TNF alpha, interleukin 2. If it's high, you have immune system dominance. For Th2, we're going to use interleukin 4 and interleukin 10, and if it's high, you have a dominance there. So if Th2 gets high, then what happens is that your body puts antibody tags on things that it shouldn't. So again, Th1 is going to try to kill it. So if this is going on, we have to figure out if there's a dominance, and more importantly, not only do we need to find out if there's a dominance, we have to find out what is causing the dominance. So something's going haywire that's making your immune system go into a dysfunctional mode. Now typically what can happen is there can be an infection in the body which the body has tried to get rid of but it can't. And so it goes into hyperdrive. It could be a fungus, it could be a parasite, it could be a virus, a bacteria, a heavy metal, or it could be food sensitivities. Now, it could also be an anemia problem, a blood sugar problem, adrenal problem. If so, how will we find out what's happening? We'd find out through our comprehensive metabolic profile if it's a blood sugar problem or if it's anemia. If it's an adrenal problem, we would find out through our ASI test. Now, if it's an infection, we may want to do some specialized testing of the gut to find out if there is a parasite, a yeast, a fungus. Now, not all of these problems will be found in the gut, but oftentimes we do find them, so we do what we call lower gut testing. There's a company you use called Metametrics. It's a stool-based test. Patients send in a stool sample, it's looked under through a microscope, and they can tell what type of abnormal microorganisms are going on, and then we will have all natural nutritional protocols to basically help your body rid yourself of these infections. So by finding the cause of the immune system imbalance, giving the proper nutrients, maybe avoiding the foods for a while if there's food sensitivities, will over time allow that immune system to come into balance, and it will stop attacking your thyroid gland. So this is a major thing that we need to look into, and more than likely you've never been evaluated for this problem. That's, again, why you're not getting better. Another test that we're going to do is we're going to do an intestinal permeability test. We may do it. We're going to look for leaky gut. And if people have a lot of food allergies, we're going to look at this as a problem. Leaky gut can also affect the immune imbalance in the body. Now, leaky gut is described as a breakdown in the barriers between the cells that actually allow things to be absorbed into the intestine and carried away into the bloodstream. And what happens is that these tight junctions that you have in your gut, they break down, and so they become porous, and what they do is they let in things that they shouldn't. Much like a screen door, you have a screen door in your house to let good air come in, but keep bad things out, like debris and flies out of the house. And so when these holes get too big, things leak into the body, and they shouldn't be there, and the body immune system is going to attack that. It's going to create inflammation. So this often happens because of chronic abnormal microorganisms like parasites and bacteria that are breaking down the membranes. Once those problems are eradicated, we may need to do some things to rehabilitate this barrier to get these junctions to seal up, to keep things from being in places in the body where they shouldn't be. It also can be caused by overuse of antibiotics. All right, next thing we want to look at is we want to look at neurotransmitter function. Your neurotransmitters are protein-based molecules that help your neurons in your body, in your brain, and in your peripheral nervous system communicate. And so if there's a problem with that communication, it can affect brain function. And also, if you have an imbalance in serotonin function, low serotonin can also inhibit the thyroid gland. And also, when you have a neurotransmitter problem, it can also increase pain. Now, typically, these problems are dealt with not so much with direct supplementation, but balancing your glucose levels. Once your glucose levels come into play, these neurotransmitter problems often clear up on their own, although sometimes they don't, and if they don't, there's specific things that we can do to boost neurotransmitter function in the body. The next thing we might do is we might also check your hormone levels. This is very important in thyroid underconversion, where you have too many of those thyroid globulin proteins because of the excessive estrogen due to birth control pills. And also to find out what your testosterone. Men often can have a low testosterone. Women, if they have too much testosterone, it causes the PCOS syndrome that we talked about. So if your estrogen, progesterone levels are off, it's going to create depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decreased physical stamina. Now, we're also going to do some specific blood markers for inflammation in general. We're going to do something called C-reactive protein. Now, most patients who have chronic health problems are suffering from excessive inflammation. Now, this panel doesn't necessarily tell us what's causing it, but I like to do this one because as we address all the other things like food sensitivities, infections, if those problems are being handled properly, then our level of inflammation should be coming down, so it helps us tell us if we're on the right track. Glutathione is a nutritional supplement that we often recommend in any chronic condition. It's especially helpful in autoimmune conditions because what it does is it actually helps calm down the overactive immune function. Glutathione is known as the mother lode of all antioxidants. The problem with glutathione is it can't really be taken through pill form because it's absorbed very poorly. So it has to be taken either transdermally through a cream, or it can also be nebulized with a nebulizer, and you basically would breathe that in and it would absorb through your lungs. But this is very helpful with autoimmune conditions. Every autoimmune condition that we see, they always get glutathione. It's very helpful. Now, we've talked about what we do metabolically for patients, and that's very important. So you can think of the metabolic side of our treatment as being the left hand. Well, we also want to address any neurological imbalances that we have, and so that's the right hand. So joining the metabolic and the neurological basically is going to create a very powerful treatment plan to help get you better, even when many other doctors that you've seen have completely failed in helping you. Now, with a thyroid problem, why do we want to treat the nervous system and the brain? Well, the hypothalamus and the pituitary are located in the brain. So if we have sluggish brain function, those glands are going to be inhibited. So it's very important that we do a thorough assessment of brain function in order to help you with your thyroid problem. So let's talk a little bit about the brain. This is the cortex here. These areas that kind of look like little striations there, that outer area that's in the cortex. This area here and this area here are blown up here so you can see them better. This is called your cerebellum. It's the oldest part of the brain. The cerebellum controls balance, coordinated movements, and the tone to the spinal muscles. It's very important. Any type of balance disorders, any type of chronic spinal problems. This is what's called the brain stem. It's composed of the medulla oblongata, where your breathing center, your pons, and your mesencephalon. A lot of the nerves, the cranial nerves that control your organs, all come out of this area. So if there's any imbalance in this area, it can cause all kinds of problems, and it can complicate any metabolic problem that you have. So let's talk about the normal function of the brain. Now this is very simplified, but it helps you understand the concept. Now typically what happens, through your environment, you're going to get stimulus through what you hear, what you see. Interacting with your environment, there's going to be a stimulus into the brain and also into the cerebellum. Now what happens is that in a normally functioning brain, a cerebellum, let's say the right side, is going to stimulate the opposite brain. The opposite brain is going to stimulate the lower brain stem, and the lower brain stem is going to be the brakes to what we call the midbrain or the mesencephalon. Now, when all that's functioning properly, that brain's going to be in balance. You're going to get healthy neurological function. You're going to have very good mental acuity. Your memory's going to be great. It's going to help you with your energy level. But what can happen, things can go haywire with this system that cause your brain to go offline, so to speak. It's not a disease, it's a functional imbalance. Now, what can happen, let's say that we have an impairment in right cerebellar function. Any type of stress that you experience physically and even emotionally or even chemically can alter the function of the cerebellum. In this case, our example is the right cerebellum. So if the right cerebellum is under firing compared to the left, then the left brain is going to underfire. If the left brain is underfiring, the lower brain stem will not get its stimulus that it needs, and then it will not inhibit the midbrain. Now, a lot of nerve endings come out of the midbrain, and when that happens, all kinds of health problems occur. Now, let's talk about different symptoms that can occur based on what we call an overactive midbrain. Okay, chronic pain and chronic fatigue. So that can complicate your thyroid problem. It can create migraine headaches, light sensitivity, it can blur your vision, it can make you sweat, it can make you have balance problems, you're not stable on your feet, it can affect your sleep, it can affect your heart, it can create irritable bowel syndrome, urinary tract infections, high blood pressure, fibromyalgia, and fibrofog. So you can see that this neurological issue can greatly complicate your metabolic problems that you have. And so we want to address both of them. And how we'll know what parts of the brain are not functioning, we'll do a very thorough neurological exam. And based on that, we'll know what parts of the brain are under firing. And we'll do all natural therapies to help balance the brain. Now, in order for the brain to function, it has to have activation, stimulus. It needs stimulus and it also needs fuel. The fuel for the brain is glucose, which is part of your digestion. We're going to address that metabolically. And we also need oxygen to make the brain function properly. Now, unfortunately, as you get older, you actually lose the ability to metabolize oxygen as efficiently as when you were younger. So one of the therapies that we use to balance the brain function is we use oxygen therapy. We have our patients exercise while they're breathing oxygen. That's a very important therapy for the brain. Their cerebellum, which is that lower part of the brain that I talked about, needs more oxygen than your heart. So that's a very important therapy that we use. Some other things that we do to balance the brain is we use vibration. Vibration fires very strongly into the brain. It's going to help the other parts of the brain become more balanced. It's going to improve muscle tone of the spine. It's very important for chronic spinal problems. We may use things like auditory, visual, olfactory stimulation to stimulate the brain, balance the brain. We also may use something called non-surgical spinal decompression, which is a special traction table that we have in the office that if you have a chronic neck problem, helps open up the nerves. And if you have had currently have disc bulges or had a herniated disc in your neck, this is an important therapy to help neurologically improve the function of the brain and the neck, which is going to again help your pain if you have chronic pain, and also it's going to help you improve your thyroid function so that energy from the brain and the neck can get to the thyroid gland like it's supposed to. So this therapy that we use to influence brain function is called brain-based therapy. Now, once we run the necessary tests to determine what's causing your specific condition, we can treat you both neurologically and metabolically with all natural solutions and nutritional protocols. Now, some important questions that I want you to ask yourself. I want you to ask yourself, how has your condition affected your job? Have you been unable to work, or have you lost income because of your condition? Is it affecting relationships with your family members, with friends? Has it affected your finances? And has it affected other activities? Can you do the things that you want to do? Can you play with your kids? Do you have the energy to go out and have fun? If you're a grandparent, can you pick up your grandkids? And what does it cost you in time, money, happiness, and sleep? Where do you picture yourself in 1 to 3 years if this condition is not handled soon? Then you may think, my condition is very bad, how can it possibly get any worse? Well, you may have said that, 2 to 3 years ago. Believe me, it can get worse. And it will, unfortunately, will get worse without proper treatment, because this is an ongoing problem that you have. Unless it's corrected, you cannot get better. Now, interesting, the average adult in the United States lives to about age 77. So that's about 28,000 days of life. If you're 50, you've only got 9,000 days left. So how do you want to live those next 9,000 days? Do you want to be remembered as a person who was fun to be around, who was active, or do you want to be remembered as a person who had increasing limitations and probably ended up being a burden to their family? I cannot answer these questions for you. You have to answer them for yourself. And what is it worth to you if we could improve your condition? Now, there are basically three criteria that patients who consult our office need to agree to in order to be involved with our programs. The first criteria is that you have to be willing to make a lifestyle change. Most Americans are on what's called the SAD diet, Standard American Diet, which is not very good, and in thyroid cases we almost always find that it's contributing to the problem. So you're going to have to make some lifestyle changes, and you're probably going to have to make some dietary changes. They're not that hard to do. Personally, I'm actually gluten-free, and it's helped me tremendously. We often do find that gluten is a problem with the autoimmune thyroid patients. So if you're willing to make a lifestyle change, I can help you. If you're unwilling to do that, I can't help you. In fact, no one can help you. The second criteria is that you have to take personal responsibility for your condition. It's not your spouse's responsibility, it's not your insurance company, it's not the government, it's not anybody else's responsibility other than yours to take full ownership of what's going on and what you need to do to get better. And I'll teach you what to do, and if you'll follow what I recommend, then we're going to get outstanding results. Now, the third criteria is you need to understand that your insurance policy will not cover all the care in my office. If you do have a good insurance policy, it will cover a lot of the care, but it won't cover all the care. So I don't want you to consult my office if you expect your insurance company to pay all the care. We do have payment plans, and financing is available. The care that we're doing is different than what you have been. In order to get a different result, you're going to have to do something else. You're going to have to invest in yourself in order for you to get better, because if you don't, nothing's going to change. Now, if you are highly motivated to get better, I want you to take advantage of what we offer in our office. Now, your next step is to give our office a call, talk to our front desk, and tell them that you would like to have a consultation case review with myself. In that case review, we're going to review all your medical records. We're going to take a very thorough history on you. We're going to do a very comprehensive neurologic exam. We'll decide what metabolic tests we want to run. And on that first visit, I will actually do some neurological based treatment on you. And what I'm looking for is I'm looking for some immediate change in your function. In my experience, if we have an immediate change, it's a very positive sign that I'm going to be able to help you. And then on a follow-up visit, I'll talk to you about what I found, and I'll present to you what we need to do. And at that point, you get to decide what you want to do. But again, I only want you to consult my office if you truly want to get better and you're willing to do what I'm asking you to do. Without your cooperation, I'm not gonna be able to help you. So if you're highly motivated, I definitely want to help you, and I'd like you to call my office. Now, in the last 25 to 30 minutes, we've talked about how our program is totally different than what you have had. And that's why it's very successful, and that's why it's going to help you. So I look forward to meeting you. My name is Dr. Taggart with Lake Washington Chiropractic, and I thank you for watching.